Dr. Santosh, sorry to make you wait
No
on this,
problem.
but I think adding on and carrying on the subject of permissions and publication ethics, Dr. Santosh Honavar needs no introduction, and he will talk to us about all what you want to know about publication ethics. Over to you, Dr. Santosh.
Thank you, Vanity. I'll be speaking on the aspect of publication ethics. Well, publication ethics is not a transient line on sand. It's an indelible Lakshman Rekha you should never cross because there are a lot of legal and other implications. It can harm your reputation. It can harm the reputation of the organization that you represent. And not just that, the innocuous co-authors who are not aware of the misconduct that the author has indulged in can also get into the net. So ethics in publications are of four folds. One is, of course, the responsibility of the authors that I'm talking about. But beyond that, there are other ethics that are involved of the reviewers. Reviewers are not supposed to use any of the material that they have reviewed for their own good. In the sense that if I have a paper which has 48 cases of a kind of series that I'm interested in and I have 100 odd similar patients, I can't reject that article just for that purpose and propagate my own series. That is unethical. We are not going into that aspect in this lecture today. Publishers also have ethical boundaries and editors of course have a very strong ethical boundary. They cannot favor one person over the other just because they know that person or otherwise. Now research is based on trust because based on what you publish, several things can get changed. It can affect the health of the patient, it can affect the economy of a country, it can affect everything about health and the way medicine is practiced, way ophthalmology is practiced. Research is based on absolute trust and there should be no crossover of this trust barrier. And trust, as you know, is very hard to build and it can be lost in just a second. One mistake, knowingly or unknowingly done by the author or the co-author, can lose this trust aspect. Loss of trust has a cascading effect not just on the author but on the entire group of authors, on the institute and even for that matter country. Some of the countries are considered unethical because some of the authors there of that country have had a lot of detractions. So it can have an implication on a very broad scale. It can harm human lives, it can harm vision if you have propagated a treatment modality that has a lot of side effects which are not revealed in your research paper that can harm vision, and it is impossible to earn trust back. It's absolutely impossible unless you are a politician. You know, election can make politicians reborn, but not in publications. You can never be reborn in the realm of publication. Being an author involves a lot of responsibility. One is that you're responsible for the originality of your work. You should not do data fabrication. You should not indulge in data misinterpretation, data or image manipulation. Even cropping up of an image which has something which can have an implication on the publication is not acceptable. Brightening the image, changing the contrast is okay. Bringing the image to natural colors is okay, but not hard editing. Plagiarism, of course, is absolute no, and authorship has to be appropriate. Now, Rohit, I think, has already spoken about ethical approval, etc. So I won't go into the details, but it is mandatory for all scientific publications. Either you get a waiver for a case report. Some of the journals are happy to give you a waiver from ethical approval. But otherwise, if a journal does not give you a waiver, then it is mandatory for all scientific publications, including video publications. You can either go through your institutional review board or ethics committee or independent ethics committee in your own geographic location, which is 50 kilometers. They charge and their registration validity is supposed to be listed on their website, which is easy to find, but they charge a lot. It should be an accredited ethics committee. This has been already made clear to you. Now, if you're doing a prospective clinical trial, even if it is a thesis, if you want it to be published, from 2009, there is a rule that it has to be registered in clinical trials registry in India. Any trial involving human participants of any sort of intervention, including drug trials, surgery, preventive measures, lifestyle modifications, devices. For example, yoga causing reduction in IOP has to be registered. As simple as that. You're not doing any intervention. You're just asking the patient to meditate for 15 minutes in the morning and measuring his IOP, but that has to be registered if you want it to be published. Devices, educational and behavior treatment. That means that you're validating two methods of teaching small incision cataract surgery. If it is not registered, it may not be published at all. Indian journals are slightly lenient towards this aspect, but the government is not. So this is something that is very mandatory. Rehabilitation as well. So it includes PG thesis. So PG thesis don't come under an exception. So whenever we accept an article arising out of a PG thesis or for awards, we should evaluate this aspect. Now, informed consent is mandatory for all study participants, and ICMR has a template which you can use as a broad-based template, but you can actually modify this template to customize it to your requirements and your study requirements. This template is not all encompassing. It is a very structured template, all right, but it has to be customized to suit your requirements. And one important aspect is that it should be available even for retrospective studies for and reproduction of images. So how do you do it? You are working in an institute or an organization or even in your clinic. Now after 5 years you realize that, well, I have a rare situation where I have 8 cases of this particular rare disease. Now I want to publish it, but you don't have any permission from any of the patients. So at the beginning of your practice, in my practice for the last 25 odd years, I have been taking a blanket consent from all my patients that their data can be used for scientific studies and their image can be reproduced. If they refuse, I make a point in my medical records that the patient has refused consent. And whenever you use such an image, obviously you have to crop it and mask their part of the face, etc. But being an oculoplasty surgeon, sometimes you have to show the face. And we have a mechanism where this consent is obtained. And if a patient hasn't given consent, we will not show these records at all or even use it for publication. So we have a mechanism to obtain a blanket consent which is valid. But some journals are asking for fresh consent. Like I submitted an article for British Journal of Ophthalmology. Only a part of the face was visible. I submitted my blanket consent. They said no, blanket consent is not acceptable from this point onwards because Europe has passed a law against using blanket consents. So you have to give a fresh consent, and 2 of the patients were deceased. They were no longer there. So I had to remove those 2 patients and get consent from the other patients who are alive. So that strict they are. So you have to be very sure about these aspects. Now data ethics concern to fabrication. Fabrication is drawing conclusions from data that is not generated by the study at all. That means that you are cooking up data in very simple words. Ballooning is fabricating higher numbers than real. If you have 30 patients and you're reporting a series of 300 patients with the same percentage, 18%, 18%, but your number was 30, you ballooned it up to 300, that is unethical, although your conclusion may just be the same. Falsification is manipulating research material, equipment or processes, or changing and omitting data or results such that the research is not actually accurately represented, including standardization of an applanation tonometer. If you haven't calibrated an applanation tonometer and have used it for a particular study and have stated that the applanation tonometer has been calibrated, that is supposed to be unethical because that would have under-measured or over-measured your IOP. Journals may summon raw data even after publication, so you are bound to preserve all your medical records and Excel sheets in a folder. Loss of data, change of laptop, lost laptop are not excuses. You are supposed to preserve this data at least for a significant number of years, 5 to 7 years, because this can be summoned at any time. And if you're not able to reproduce, well, it is taken as a negative aspect in terms of the research, and the entire team can get blacklisted without you knowing. Sometimes you realize that a journal is not publishing your articles at all, sending it back without even a review, and the reason could just be that somebody from your institute has indulged in this aspect. That's the reason why the journals are not proceeding with your articles. Secure the data set, including patient tracing information, in a backup hard disk which is protected and kept safe. The true meaning of plagiarism is kidnapping, or plagiarism is a kidnapper. It refers to use of previously published work by another author without consent, credit. So even if you haven't taken consent, you have to give credit to the previous author. or acknowledgement and fraudulently passing as his own work. Sometimes it happens without us realizing. If you have read an article 20 times, the words just come into you, you just keep typing the same words or similar sentences that the author has used without realizing that you're reproducing a majority of the paragraph that you have read from a particular article. So you should be very guarded against that. It's the most common form of publication misconduct. In fact, about 40 to 60% of articles have some amount of plagiarism. About 15 to 20% is excusable because definitions cannot change. What also cannot change are the diagnostic criteria. You cannot rephrase diagnostic criteria or definitions, so you should use the same words. That is acceptable. If you're writing a review article, your plagiarism could be as high as 25 to 30%, but as long as you're able to justify it, it is acceptable. It could be drawn out of your own work, which you can't change in terms of, say, paraphrasing, which is acceptable. So editor has a responsibility to assess whether it is really plagiarism or because it's just a review article with a lot of definitions and diagnostic and therapeutic results criteria that are involved, that it looks as if it's been plagiarized. It's actually stealing if you have done it, with the intent of doing it. There are many definitions of plagiarism or types of plagiarism. Complete is obviously, as it indicates, direct, paraphrasing, mosaic or patchwork or potluck plagiarism. You take a bit of this, bit of that and put it in your article. Self-plagiarism is what you have written earlier. You reproduce it exactly nearly the same. That means I have written a review article for Delhi Journal of Ophthalmology. I find an opportunity to write for Survey of Ophthalmology. I reproduce almost the same article for Survey of Ophthalmology with just a few new articles added in the review. That is not acceptable. You have to rewrite the article with the content being almost totally different. Otherwise, it's self-plagiarism. Source misinterpretation, misrepresentation, that means you are quoting some article, but it is not from there. That is also considered unethical, and sometimes it is accidental, as we already described. So how to avoid plagiarism, even unintentionally, is to try to be original, summarize available knowledge in your own words, make sure that you're not kind of habitually reproducing certain paragraphs, paraphrase line by line if you have to reproduce a concept, quote if it is directly reproduced. That means it has to be included within inverted commas, quotation marks, and the author has to be quoted either by a superscript or whatever the journal provides parenthesis. Use appropriate reference, and always check for this before you submit it to a journal. It's a very simple thing. If your postgraduate student or your fellow has written an article, make sure that they use any of this software. Some of these are freely available. Some of these are free to access, some of these are minimally paid, but they have to submit it along with the article with the first draft itself so that you know what is the amount of plagiarism. And in fact, when you use the software, the portion that is plagiarized is actually highlighted. And you know exactly what has been plagiarized, and if it is nothing significant, you can rephrase those sentences and help your own fellow or a resident. Now, simultaneous submission is also unethical. That means I submit to IGO, and I know that IGO will take 6 weeks, but I also have a journal which may take 4 or 5 weeks. Now I submit it to IGO, but if it is accepted in another journal, I ask the journal to withdraw. This is happening, very common. In fact, it is quite common. People submit to 2 or 3 journals, and from whichever they get acceptance, they go ahead with it, and rest of the journals, they ask for a withdrawal. That is not acceptable. Can submit after only a categorical rejection. Even if your article is under revision, you cannot submit it to another journal unless it is rejected. Duplicate publication of substantially similar material, even in a journal not indexed, is not acceptable. That means you have an institutional journal or your university journal where you have published something, then you want to submit it to IGO, absolutely not acceptable. Reason being, what is not indexed can also be found on the net, right? Because these are the days of digital media, and you can actually search for a particular article on the net even though it is not indexed. Conference presentation and publication of the abstract in proceedings is acceptable. Now there are 2 terms that you must know: salami slicing and beef up. That means you have a large retrospective or a prospective study that has lot of parameters, but you want to kind of divide it into 3 or more publications. This is very common. This is happening all the time. In fact, for larger multicentric trials, they say publication number 1, publication number 2, 3, 4, 5, 6, 7. But if it is not justifiable, you have just divided the study results into multiple parts just for the sake of many publications, that is not acceptable. Beefing up is you have a weak study, but you have another data set which you combine purposefully to make the study stronger, then even that is not acceptable. Going on to authorship ethical aspects, all persons designated as authors should qualify for authorship, and all those who qualify should be listed. Both are unethical. If you have a colleague who has helped you with the study, but you have missed him or her just for the purpose of missing him or her, that is not acceptable. Similarly, adding a head of the department, even though he or she is not involved in your work in any way, not even reviewing it, is also not acceptable. So you have to be very, very clear with it. Now, authorship criteria are very clear. The author should have substantially contributed to conduct of the study, including its conception and design. Somebody has helped you design, he could be an author. Helped you acquire data, optometrist has helped you acquire data, she or he could be an author. Has done statistical analysis for your study with or without payment, he could be an author. And has helped you interpret, he could be an author. But unless they're not involved in the study, they cannot be authors. Drafting or revising the article for intellectual content can be attributed to authorship. Approval of the final version can also be attributed to authorship, but you have to mention actually what is the role of the author in all that. Extent of contribution decides the order of authorship. This is also very clear. Somebody who has contributed substantially cannot be put in the middle as the third author, whereas you yourself have assumed to be say corresponding author or the primary author. That is also not acceptable. Now somebody can complain, that is the reason. So your thesis candidate goes and complains that, well, my guide has put me as the third author, whereas I have done the study. Well, that is unethical. You know, three terms here: ghost author, gift author, and guest author. Ghost author is somebody who's not listed as an author, but you have used that person to write your article for a fee. That's a ghost author. Gift author is you have gifted the authorship to somebody just because he's a big person. Guest author is somebody who you have called in. Now I have an international collaborator who is a very big name. For example, I just put Carol Shields in just to get my publication in ophthalmology. Well, that is not considered ethical. And even she wouldn't not agree to be a co-author unless she has substantially contributed. So guest authors are not allowed. And conflict of interest. Now people keep wondering, well, if I am advisor to a particular company and if I done a study which is something similar to do with that company, is it unethical? It is not unethical as long as you declare it. So having conflict of interest is absolutely acceptable. Failure to disclose that conflict of interest is unethical. Now there could be direct financial, indirect financial conflicts, but all of which has to be kind of disclosed. Self-citations. Indian habit, this is purely Indian Asian habit that we keep on citing our own articles, and anything more than 12 to 15% is considered unacceptable. In fact, in Stanford ranking of authors valuation, they mention they have an additional column in their Excel sheet which removes those self-citations and gives you a separate ranking. So finally it will come into being formally that they'll remove self-citations for good. Questionable research practices, selective reporting of dependent variables. These are mainly to increase your QRPs. Collecting more data after the study is concluded to try and make the findings significant, happens in situations of thesis. Reporting selective studies that worked and not reporting studies that did not work. Rounding up p-value to make it significant. These are all very commonly done. Reporting unexpected findings as having been predicted. So all these are considered unacceptable. Now, paper mill is a profit-oriented organization which can generate paper for you, but these are heavily plagiarized material. Use of artificial intelligence to write paper, ChatGPT to write paper is not acceptable. Just before I remitted my office, I had a submission from an author where he had lifted ChatGPT as a co-author. That is not acceptable. So these are things that are being debated because increasing use of artificial intelligence is, well, for us to live with. But consequences of all this can be severe. Whenever an editor finds that there is a misconduct, they inform the authors And if the authors are not able to justify the misconduct, then you should reject the manuscript and inform the institution and the ethics committee. If the manuscript is already published, if it's a minor misconduct, then publish an erratum, which is punitive enough because erratum actually describes exactly what was wrong with the study and why we have corrected it. That's a punitive measure. It can be noticed because it's on PubMed. If an error is major, then you can revoke the manuscript or withdraw it, inform COPE member journals if you are a COPE member journal, blacklist the author and inform the institution and the ethics committee. Sometimes they can counter you saying that your action is unjustified, so you have to actually process this very judiciously. There are COPE guidelines and also you have to set up a committee to investigate this aspect because you cannot take the responsibility as an editor on yourself to have taken this action. So you have to have a backing of a committee, which is a voice of educated, expert individuals who will back up your decision. Otherwise, your individual decision can be questioned because of bias, etc. And that could come on the author or on the editor heavily. Then institutional discipline is demotion, punitive measures including termination. Those the institutes have to take. Now, if you want to read more about it, Sen Gupta and me had written an article on publication ethics in Indian Journal of Ophthalmology in 2017, and most of this is relevant. And we have a publication ethics checklist also there. And there is a website which is called publicationethics.org, which will give you much more information and in fact scare you for all, because it has a lot of information, and whatever we do something, even if we do something which is very, very innocuous, that can come under the radar of publication ethics. So you should be very careful, but if something happens by mistake and somebody has done a mistake in your own group and it's a minor error, it's a good idea to inform the editor and let the editor take it forward, not hide it because somebody else may discover it and the consequences then can be much severe. Thank you so much.
Thank you very much, Dr. Santosh. I think that was a comprehensive coverage of what one has to look into when you're publishing on your thing. There's one question which I want you to see, that I do have a lot of submissions which are coming from a particular country, and I know they are not lot of publications, a lot of submissions coming from a particular country. I know they're not very good in writing English,
Right.
but sometimes you find it is too good to believe that
Right.
this English is, and I several times do suspect that ChatGPT has been used to write out this entire manuscript. So, and how do I go about it, or how do I, even if they do acknowledge they've used a ChatGPT, they don't. So how do we, go about this?
There's an AI use detector software which you can run the manuscript through, that will tell you whether AI has been used to modify the article or write the article, and if that is substantial you can reject it straight away, or ask the authors if they have used AI for writing the manuscript, and if they admit that it has been indeed used, you can reject the manuscript. They may actually have used a writing service. Using a writing service is acceptable because they may have written the article in Chinese or German, and then they may have used a medical writer to translate it into English. That is fine.
Okay. Thank you.